Meanwhile, there is also a focus on what programs the state government has for struggling families. That includes funding that hasn't been increased in 30 years. All new here at 5. Channel 9's Nick Papantonis is live in our studio. And Nick, you spoke with lawmakers on both sides about why changes weren't part of the big pregnancy package.
That's right. Yesterday, lawmakers put those abortion limits into place, increased funding for non-medical crisis pregnancy centers, and expanded access to children's health care. But they didn't boost a program for needy families that now barely covers the cost of diapers.
70 yeas, 40 nays, Mr. Speaker.
Show the bill passes.
When Florida lawmakers passed tighter abortion restrictions into place, there was a lot of talk of protecting life.
It feels as though we just broke down a wall and were able to save more lives.
But policy analysts point out lawmakers ignored a program for struggling families that hasn't been updated in 3 decades.
It's inadequate as it is, and now if you're going to be adding more children into the system, it's just not going to accommodate all the families.
The Temporary Assistance for Needy Families, or TANF funding, provides a lifeline for parents who struggle with the cost of raising a newborn. In 1992, lawmakers set payments at $180 per month for the first child and $60 per month for every additional child. To qualify, parents must work or have a disability, be legal residents of the United States, and there are severe income restrictions.
I'm hopeful that the next leadership will be more open to these conversations, and I think a part of it is breaking the stigma and breaking the misconceptions.
WFTV reached out to the offices of most Central Florida Republican representatives to ask if it was time to take a look at increasing TANF. Many were unfamiliar with the program. Osceola County's Paula Stark says one bill didn't move forward, but she's going to reach out to the sponsor.
I think anything that helps children be successful and healthy is worth looking at.
Representative Randy Fine told me this year's focus was on expanding kid care, which happened yesterday. It expanded access to health insurance for children in low-income families.